a big issue, as I alluded to, is now that we have a number of drugs, trying to figure out which drug to use first. Are there any markers that indicate that one treatment would be more effective than the other? And essentially, I don't think we have any clear answers to that. There is not enough difference between these agents, and the methods used in the clinical trials to adjudicate attacks and the nature of the enrolled patients, I think, does not allow us to draw sufficient differences between these drugs to say we clearly have one that is superior to the other. But sorting this out and developing biomarkers that might predict which patient will respond to one drug over the other, I think that's going to be important. I think from the point of view of this polymorphism, if one were going to use inebilizumab, I think we're essentially saying there's really not a lot of point in genotyping the patient to find out whether they'll respond or not respond, because both genotypes or all the genotypes seem to respond more or less equally. So I don't think this is going to be such a marker, but I think it does bring us a little closer to understanding the differences between the B-cell depleters. In terms of the treatments, we have continued follow-up to establish long-term efficacy and safety, trying to look for those markers that might predict which patients are going to respond better to one than the other, one treatment than the other. Not directly pertinent to that subject, but I think we're all cognizant that these are treatments that are not likely to be curative of this condition and will need to be applied over a very long period of time. So there is interest in other strategies, especially immune tolerance strategies, to influence and mold the immune system in a more long-term way, so that we might eventually be able to get patients off these treatments. That's not a form of treatment that we really use for any autoimmune disease now, so it will be a big challenge, but having a clear idea of what the target antigen is and improved understanding of biomarkers, I think makes this feasible, and certainly there's a lot of interest in immune tolerance for the future.